Hi, dear friends. I welcome my dear colleague and junior and my beloved friend and faculty of the Koncpt in surgical oncology. He's a wonderful teacher as well as a great surgeon. He did his MS at Stanley Medical College, where we were together, worked together. Very dedicated person, and he is a consultant surgical oncologist and HIPEC surgeon at Apollo Teynampet and Apollo OMR at Chennai. So he's a very passionate oncosurgeon. He loves to become an oncosurgeon. That's how he joined oncosurgery, and he had almost, I can say, completed oncosurgery more than 10 years back. And he is a senior practicing oncosurgeon at Apollo. See, the purpose of this today's discussion is pure guidance for oncosurgery aspirants. How oncosurgery aspirants should groom themselves in the upcoming 3 years. With all this thing in our mind, we are conducting this session because many have last year ranking and counseling pattern. We add some points with regard to that, but the future after MCH is a very important aspect which all young budding oncosurgeons should know. Welcome, Dr. Vimal Adityan. Please convey about, tell something about you, Vimal. Vimal, you can talk up. You can talk. Yeah,
thanks, Dr. Antan, for the kind words. It's hope to be a live discussion, not only able to talk about the subjects proper. It's really good. Next session, how to go ahead for a courses. It's a very lifetime to choose career, to know where it was good, and choosing especially for super specialty. That too, you created a nice platform as just direct interaction with the faculties. It's a good initiative, Dr. Antan, sir. So I'm looking forward for more chats and we'll be able to discuss it lively. Thank you.
Yeah.
Sir, voice is not there.
Yes.
Yeah, now it's okay.
Most importantly, every students were asking is like what to plan. So which one to take in MC? If MCH is an option, what is the top 10 MCH colleges? Do you have an idea about top 10 MCH colleges?
The voice is not breaking a little bit.
Now audible, Vimal? Hello, check. Vimal, I think you have some internet issues.
MCH, wherever the college you're looking to prefer.
I think you have some connectivity issues, Vimal.
So basically, what you're asking is top 10 in the sense?
With respect to the cutting chance, with respect to the academics, brand of the college, etc. Vimal. Vimal, are you audible? Vimal, is it audible for you? I think some connectivity issues. Dr. Vimal will join shortly. Many MCH oncosurgery aspirants, the biggest question mark is the top 10 MCH institutes and the top 10 DNB institutes. Which is good. How to go about that is the important aspects every aspirants thinks about it. Before Dr. Vimal discuss about this, I want to share like how we have to plan for the MCH or DNB, how to prioritize where to join. So now, due to the outbreak in the last 2.5 years, people knows the value of being nearer to the home rather than going away from the home. Yeah, Dr. Vimal is joining.
Yeah, sir. Now it's okay. Sorry.
Welcome back, Vimal. Yeah, okay. I'm just complete these words. So after this epidemic, many are feeling like they wanted to be nearer the home with the spouse rather than going away from the home. So have that in the mind. You choose the institute where you want to join as a resident. So please go ahead, Vimal. So when I minimize, you may not able to see me. So I will come back again when you are talking. I will be minimizing the screen. So kindly go ahead. What are the so students wants what are the top institutes as a toppers? They also will be working a lot. So as per your experience in the last 10 years and some of the residents also along with you, what are the top 10 institutes which the students can join in the upcoming session?
So basically, if you want to choose a good career, all the institute will be good, sir. When you ask for top 10 in the sense, basically all the oncology institute in the premier at the state level, most of the students will know that first we'll prefer to go ahead for a Tata and Kidwai and South RCC in Trivandrum, and main thing Nadayar Cancer Institute in Chennai, and AIMS definitely will go ahead. These are the 5 top institute. All the other things based on the corresponding state, they are having a good institute. Like even Gujarat, you can go ahead for GCRI, and like similar institute as having. But top 6, I will prefer it on these 6: Tata Memorial, GCRI, AIMS, and Adayar Cancer Institute, RCC Trivandrum, and Kidwai.
Okay. So other thing is like a DNB. How many? What are the top DNB institutes? When there are some people who wants to join a DNB in their native place rather than going to take MCH in other states. For them, what will be the your preference of DNB institutes, Dr. Vimal?
Okay. So the DNB Institute don't anything compare. DNB is inferior to MCH. I always stress the students. It is equally important nowadays. That too for super specialty. If you are joining in a good institute as a DNB surgical career, especially oncology, there are a lot of institutes upcoming. There are even seats also is increasing more. My preference of choice, for example, if you consider as a DNB, there are limited seats in South. I'll discuss everything, and preferably Rajiv Gandhi in North will be very good for DNB, and Bhagavan Mahavir College also is very good. And if we take it as a South, we prefer 3 institute. One is Indo-American in our on Telangana, and main thing Manipal, and HCG in Bangalore, and Malabar Cancer Institute Kerala, and our center Apollo Cancer Center and Global Hospital in Chennai. These are all the rank we prefer to go for a DNB surgical career. Little more, have a good exposure of the cases. Wherever you go, there are certain limitations in hands-on training when compared to MCH. But definitely, when the working atmosphere and the learning experiences from the senior professors and the practical knowledge will gain more when you even in DNB also. That's what I want to convey. So to summarize, from North, if you take it as Rajiv Gandhi, and Bhagavan Mahavir, and when come to South, and Trivandrum Malabar Cancer Center, Manipal Hospital in Bangalore, and HCG in Bangalore, Apollo in Chennai, and more preferably Indo-American will have a very good minimal invasive exposures. So these are all my preference of choices. People would go choose this will be a better career, especially for the DNB. There are a lot of other in upcoming institution. They have limited seats. They are also having good exposure. Don't too much on crazy on the seats, but these are all the preference choices. Rest of things, wherever you join, just please accustom. Definitely you'll get exposure in the DNB.
Yeah, true. Most important, rather than the place or institute where the faculty keep changing, like becomes a professor, or they
Exactly.
go to the other hospital, or they retired. All those things matters a lot.
Matters.
So yeah, where the case is good, assistant professors are good rather than a professor. All this will be a better choice rather than depending upon the unit or a professor. They by the time when you become a final year, if the professor retires, then job is over. So in that, kindly enlighten the students so that it is not the, I will always say, it is not only the institute which matters. Not big institutes give a big chance, but small institutes give a big chance. You will learn nearby maximum. So please enlighten about that, Dr. Vimal.
So this is a part and part of surgical career. What exactly you told, you need to understand. The only institute, don't think about that. What you said is exactly correct. There are a lot of particulars you need to assess, whether especially this type of COVID time and everything, your nativity is also it's important, and The hospital side, what are the professors and senior professors? There is not like a curriculum in like MCH. You will all have a lot of, even in DNB, there are one or two senior professors. If you have a good surgical exposure, there will be atmosphere is very, very good. And choosing this, the 3 years period, we don't know many consultant will change and the institute will go with other alternative consultants. So just think it's a, some choose premier institute wherever you already have exposure of more. Please join. Definitely you will learn at the time as goes second year or third year period. So I don't compare industry, not inferior to MCH at all.
Yeah, well said, Dr. Vimal, and all people. The one which is again running in mind for the students who are joining a residency is oncosurgery residency is how to manage the spouse and how to manage the family, how to manage the kid and preparing, because some may be married by 25, 26. Also, in general, doctors marry later. But even though if they, and another question, if they marry by when they join the residency, these are all very practical issues. I always tell in urology, the first year is not the right time to marry at second year, because you can't take two stress at the same time. The first year of joining a residency and marrying and managing the family in the first year is not an easy job. So urology per se is a little bit easy in majority of places rather than institute like SGPGI. So many places, especially in Chennai, it's very easy to run the show, run the family and education. So what is your experience? What is your input? I can say, because you have completed very long back in this scenario, how youngsters should go ahead and manage the family and the education, doctor.
Okay. So when compared to manage the family and your DNB super specialty career, there are a lot of things to be considered. For my personal experience, the first financial aspect where you are going to join, that you need to run the family. It's not only your career don't choose that much. So career is my 3/4 of its important, because you are 3 years choosing this DNB or MCH, that is the rest of your life. So please spend that, and as well as choose the colleges where you'll have adequate stipend and how far you are from nativity. Please remember that also is a part of career. And meanwhile you'll choose the family commitment also. So either, even if you are getting a DNB to nearby community and you have reasonable exposure, rather than going very long from, for example, Northeast patient to coming to Chennai, or Chennai to come to go to Delhi and all, it's really, if it's based on the institute, we'll choose. Or else, considering the family, especially more than 35 years, you need to choose balance both family and as well as the career. So first thing, what I think, 3/4 career is important, no doubt at all. But meanwhile, choose this financial, career, and reasonable exposure is good enough.
Yeah, well said, doctor. And one more thing, as you said, sir, I add a point. During your residency, if your stipend is poor, please give a representation. At least when you become a final year, you will get some hike in your stipend. So not necessary always. There is no explanation in the institute where we learn. We should be calm with our seniors, assistant professors, and professors. There is no doubt in that. But certain things which we can not neither directly, some may be directly enough to open the mouth, some may be indirect, some should be, at least not some, everyone should be indirect enough to open the mouth, like stipend. If issue is there, stipend is not good, and that definitely will help to raise the stipend, because running a family with a meager amount definitely will be a headache, because another point, rightly said, distance. If you are away from your family one or two times, if you go by flight or for emergency, like 30,000 easily it will be lost. So plan all these things accordingly. And other important thing, for because now very important is managing the family with as you rightly said, and the point also you have added, when they join, definitely they will be learning things. Learning is will not be an issue. We'll go into about the learning also and the subspecialty also. But what about a resident, other than top institute where their workload will be very high, like they have to go by 7, they will come back by 10 p.m. But stipend also will be very good, like 60,000 to 70,000 per month. But other places where stipend will be like 30,000 or 40,000 and or 50,000, something like that. Those cases, those places, how to earn while they learn oncosurgery? Any ideas in that?
Sir, this is the tough question. It will be really answered by you only. You are the right person to fight and to how to earn. You not only are my senior, you are a well-wisher. You taught me even at the PG period, but I am not the right person. This is the you can answer the question. Please go
No,
ahead,
yeah,
sir.
I know. I can add little bit, but what the thing is like oncosurgery as such during your because I can't compare myself in urology with the oncosurgery. Before answering that question, can you please tell me the work pattern in oncosurgery, other than the top institute, so that whoever they listen, they should get some inputs. It will be definitely useful. It should be useful for them, that should help them in their lifetime. How the work pattern in each college, other than the top institutes where 7 a.m. to 10 p.m. their life goes
Yeah.
daily.
Yes, sir, that it was there what you are told previously when the PG students is less, what you call 6 a.m. to 10 p.m. is a standard. That even a remaining 8 hours, they will have only 4 hours or 5 hours of sleep. This really stressed how far they are able to learn the surgical steps and the academic and everything will be labs when you choose on these type of higher institute. But nowadays, even with reasonable working atmosphere in a lower institute and having a reasonable exposure and good timing to learn the basic surgical, there are a lot of medias now helping to learn the surgery. So my personal choice is 6 a.m. to 10 p.m. Definitely, you are not able to concentrate on the surgical stuff. You can assist almost 10 to 12 cases per day. It's not going to be a benefit. But my personal suggestion, in between the balance, should not go to the institute, will not at all giving a cases, well as exposure. So balancedly will go even 1 or 2 cases per surgery per day. You're having good exposure. That's good to balance the career. So that's what my personal choices. So there are a lot of institute, even in MCH, recently started and working in the DNB also. Around, for example, 7 to 6 or 7 to 5 will be reasonable. Depend upon it will be changed. So please go. Number of quantity is not important, especially as a super specialty. Doing for example, 200 MRM or 300 MRM, learn the basic steps as surgery. 10 to 15 cases per subsite. You will learn this in the 3 years of career. Almost, for example, 20 to 30 major surgeries is there that you learn as a step by step and good learning exposure. You will definitely come out with a good flying colors and you can start your own practice. That's what my suggestions.
Yeah, true. And one more thing I want to add, as such, in MCH is concerned, out of 10, only there will be 2% will be good-hearted enough to give a chance to learn in majority places, other than places where the case loads are high, where the institute depends upon the resident, final year resident or second year resident to manage the patients. Otherwise, majority, like out of 10, 2 or 3 max can be guiding and helping the resident to learn exactly. So we all should be we all should go with that mind. Okay, so find a way how to earn during your learn during your residency. I will come to the earning part later. Earn during the residency. So keep calm the first 6 months or 1 year. Don't get into the controversies, because as we knew very well, all professors and not all, I can say majority professors and assistant professors are highly egoistic, and they, if somebody raises the voice, they keep irritating like a core. And that is a system which has to change in country like us, where other countries where a resident has to do at least, if urology is concerned, minimum 2 or 3 transplant, or a lab 2 or 3 lab minimum has to be done. There are criteria are here, but nobody gives. So that kind of situation has to change country like us. Until that, it is still gurukulam. Even if you and I become goes in the gurukulam, still the professors ill treat, irritates, create a nuisance for a resident. So go with a mind, with a very strong mind. No one should shake your mind at any point of the time. Okay, especially I am seeing in oncosurgery in Chennai, none of the institutes are ready to give a chance, in especially government sector, to give a chance to the resident, and the residents are really suffering to learn. This is one which I am seeing here, but other places also, maybe the percentage may vary, but be ready to face a situation. That is the bottom line I want to share. Be ready to face a situation. You and your family might think you will be learning left and right in 3 years, but At the end of 3 years, you may even learn 1 or 2 major surgery, or even just assist in many cases. So be ready. It doesn't mean you will not be a wonderful surgeon. Be ready to face, and with zero expectation you go, and still you will rock. I think that point which I want to add, Dr. Vimal. And regarding subspecialty in oncosurgery, which is coming up, and future oncosurgery, because I will come to the second one, future oncosurgery, subspecialty in oncosurgery, how a resident should be ready for the subspecialty during their PG period, Dr. Vimal.
Sir, to add to your point, what you said is what you call patience. For that is when you're choosing this career, what my professor will tell that 4 P's you need to remember. First thing, professor management. As a DNB or MCh student, you need to exactly what you told, how to deal with the professor. That is very, very important. That another thing, patience. Patient load should be there for any career, and be patient by personality. And fourth P, what you'll tell us, what you call personal life. Don't professional management, professor management, personality with your families, and for the patients, you need to work hard with the patients. That's what for 4 P's or 5 P's to lesson, especially for surgical career. If you manage all these things, only you can able to give a good success in the others. And what you asked in this last question, sir, I forgot.
Subspecialty in
Yeah,
oncosurgery.
subspecialty. So in oncology itself, subspecialty. When you choose further subspecialty, where you are working. If you going in a district hospital, I'm doing from head and neck cancer morning and evening doing a vertim cystectomy is good enough. But if you want to have a good headquarters or some like a tertiary hospital, it's now maybe another maybe 1 decade or 5 years later, it is going to be like the field. There are a lot of subspecialty already. MCh head and neck oncology, MCh gynec oncology is coming. There might
Yeah.
be still 7 to 8 subsite might be there. So at the career, don't think too much of subspecialty. Initially, you learn all oncology will be almost streamlined. So at the end of last year, you try to confine by yourself. Choose some specialty that will be going to be your interest, and rather than just learn all the head to foot, that is only oncology field having like this, not like in a urology or something like a cardiothoracic surgery. But having said that, please be as a focus of one subspecialty and concentrate on that. Rest of this, you'll just learn all the things during the career. At the end of this, you will have some interest. First year, best be get interest what you're going to get. Second year, you definitely will go ahead. Sir, my mine is this much. Okay, please go ahead from the third year period onwards. Along with that, you have link with the international level or national conference. Be focus on your subspecialty and keep going.
Yeah, true. I understand. I got the point. Which I want to convey here is like in corporate hospitals, like subspecialty, all those things are really working, and it's how now also being projected. And as you are also a HIPEC surgeon, and you that is one of the upcoming field, and which you really do a wonderful job in that. And but if you go to the tier 2, tier 3 cities, how really the oncosurgeons practicing life is?
No, sir. Exactly what I'm working in Apollo Cancer Centers is something different. When you choose almost 3/4 of the subspecialty, for example, district hospital or neighborhood hospital or all the things, it is not a subspecialty oriented. Subspecialty oriented, even for not you are doing, for example, you do advanced robotic thoracic surgery and sitting in your district hospital, it's not at all going to be worth. My personal suggestion, if you have to choose that area, the patient should know what it is mainstream, and the patient crowd also should come to that level as a subspecialty. So all except the tertiary or whatever the headquarters, all the other things as oncology, you need to be as a bread and butter to even head and neck, breast and gynec. All the other things, when you come practical point of view, out of all these things, all the things will go divided. General surgeon will do, urologist will do, or even other orofacial surgeon will do. That means what you will call, my professor will tell, it going to be dying fields at some point of time. But don't like that. It is definitely, it's a good upcoming field because of multiple risk factors. Cancer is still increasing. Where I did 10 years back, only 16 PGs or 17 PGs per year. Now almost more than 200 300 PGs, because it's not cancer volume also is increasing. So if you choose subspecialty, if you're in headquarters, it's good. And if you see the other district hospital, it's really, you can do whatever do oncology, all the things you can get it done, especially in other hospitals.
The other one which I want to ask here is like team practice versus corporate practice. So this is one of the upcoming, even I want to make it as a big discussion in future. Team practice versus corporate practice. How do you suggest, what is your bird's eye view about team practice, which is going to be the future? Because I will tell the reason for that. But before going into that point, content in proper, because oncosurgery is a field where you really want a medical oncologist, radiation oncologist. But in fact, if you take a transplant in urology, we never gel with a nephrologist. Okay, nephrologist will never gel with a urologist. That kind of toughest egos are very difficult to manage. But now things are changing. Even nephrologists are developing good rapport with the urologist, and urologists are also developing good rapport with. The things are changing, but it is not so when you consider 30 years back. Okay, 20 years, 30 years back. What you really guide the youngsters for team practice, because this is one which, after your words, I want to add some points, which is going to be the future.
So that same thing, what I told, depend upon is his personal choice and where you are going to practice. My suggestion, if you're having a good corporate hospital or whatever the headquarters hospital, definitely not in other subspecialty. Oncology is going to be a team practice to go ahead with a good outcome for the patient and for your personal life also. It is not like a 10 hours of doing surgery. I can't do whatever previously from morning 6 to night 10 o'clock. You can't do surgeries round the clock. So based on your subspecialty and your field of interest as a team practice, so go along with this, especially if you're choosing this. Or the rest of the hospital, for example, if you're having a district hospital and all, it is something different, where even you can go ahead with alone. So how you are choosing the career and your where you are practicing, but going to be a team practice should be for a surgeon and for the patient also.
Yeah,
That's
well
my
said.
personal bird view.
Yeah, wonderful, well said, rightly taken, good words, Dr. Vimal. Because one point in a team practice is four surgeons together working, and that is one concept of the team practice. The another concept of the team practice is having a tie-up with a medical oncologist, radiation oncologist, and establishing a setup, and or finding a spouse with a radiation oncologist or a medical oncologist. So two among the team is over. And the third team, this all the young generation who is watching should have a view. Many may have an idea, but it is not easy to manage the family as well as the partner in the profession also. But all these things also, you should how capable you are should be the decision maker, and go ahead. But the real and painful scenario which I want to share here, that is the reason, rather than leaving the egos, go for the team, because the government has created lots and lots of the like a consultant, specialist, and super specialist. The corporate has got a lot of hands. So the corporate dictates, instead of 1 lakh your fees, no, doctor, there are 5 members on the queue. You want to get 50,000, or you want to get you still want 1 lakh for this patient. This is a cutthroat practice in the corporate. So leave all of us should leave our ego, and the medical oncologists, radiation oncologists, and surgical oncologists, this kind of team should come in the future, because the government gives a lot of proposal to develop a startup company. We can even develop a private limited for a hospital setup, where even you can get 2 crores to 5 crores for 2 years, no investment. 2 years, no returns. We no need to pay within 2 years, even the interest. The interest also will be just 4%. Imagine, in those 2 years, we will just build up our practice like anything, if all these 3 members are dedicated. And adding one point in that, when you find a team, the team members should work only for the team. If the team members work for the another bloody team, it doesn't mean a real team practice. Please understand. The one fellow will be trying to be smart. They will be thinking like, I want money from right, left, center, up, down. If such case identify, please remove them. Okay, that team doesn't work. Future is a team practice, my dear friends. I really want to share in this time. and think about this. And before concluding the talk, Dr. Vimal, what is your thinking, or what is your further point to whatever being missed to guide the residents so that it will be beneficial for them? If anything else you want to share, you can share.
Nothing, just to summarize whatever I already told, that don't compare MCH and DNB, and choosing the MCH, don't crave. Nowadays it's not able to choose that. Whatever your selection criteria from A to Z, you can put whatever that's available, it's getting done. Please accept whatever you're getting as per your choices. Don't compare I am getting A or B or C. Whatever, even if you get Z, my personal experience, those who are accepting this even Z choices, they are good coming in the flying colors,
Right.
rather than choosing the A top memorial, whatever what you call top hospital, that they are also still inferior. Then don't compare. This learning surgical career got gifted wherever it's given. Please go ahead and accept the fact. Learn good surgical experiences. Definitely you will get it done. Even if you're finishing MCH or DNB, within 1 year you can get the practice. That is my suggestions. So all the best. Please go ahead and choose whatever your choices as per the institute, as per your personal life, and reasonable surgical exposure is good enough for your surgical career.
Wonderful words, Vimal. The 4 Ps. I really love the four
No,
Ps.
just I thought my professor told, so that's why I want to live, because that need to manage whatever you're telling us. All we are working for the patients, our patients, and our personality. That's what you're giving a career. Don't too much crave on that. Want to get it done and read for 1 more year, 2 more years. Please, we are already more than 35 only. We are trying to get it the MCH. So your life is precious than anything else. So please go.
Yeah, the one last word I also want to share. If suppose to get a DNB or wait for another year, rightly Dr. Vimal has told, please, if you get a seat, please join, my dear friends. No business of waiting. The pattern is changing. We do not know how the questions will come. That
That's
kind
true,
of
sir. That's
stress,
really true.
please don't take, my dear friends. Do it. Whether you want to take an MCH, you are affordable, you want to do it in a private, you are not affordable, you want to do it at a DNB, please do it, complete it. And there is a life, future life, a lot of life is there. This MCH or DNB is not our life at all. Okay, this is a part of our life, as you rightly said, Dr. Vimal. And a lot of guidance regarding the practice or business after the MCH, which you all should think. Not only knowledge, my dear. Okay, we all invest on our brain. That investment should be converted into money, so that to live a life, because we all are number one, number two when you are reading +1 or +2. Okay, with that only you and I have reached this place. Okay, it doesn't mean everyone should earn. So earn in such a way, without destroying others, without creating a cutthroat practice. Lots and lots of their paths are there. Keeps our eyes open, keeps our ears open, so that the new paths always will open. Don't follow anyone's path. Create your own path. As Dr. Vimal rightly said, find your personality. My personality is relaxed personality. Go accordingly. My personality is aggressive personality. I'm an entrepreneur. Go with that. Whatever the personality suits. And also the important P to be added is spouse also. 4P with the S you add. And that also
Okay.
important. Add and work and enjoy your life. Thank you, Dr. Vimal from
Right.
Apollo Specialty Hospital, HIPEC surgeon and a surgical oncologist. Wonderful time with you, Dr. Vimal. Whoever is viewing this in future, they also will be benefited out of this. And thanks a lot for your wonderful time, because getting a time is very difficult for every one of us. Thank you, dear.
Thanks a lot, sir. It's nice discussion. I'm not able to concentrate more on that, but really it's a wonderful time. Definitely, even 1 or 2 points, if the students has accept, so please accept wherever you're getting the seats. That is my final outcome. Please go ahead with learn good exposure. That is fine. Okay. Thanks a lot, Dr. Antan, sir. Thank you.
Thank you, dear. Thank you.